I want to turn to another health issue outside of our borders, but still very concerning. The Ebola outbreak in the eastern DRC is spreading rapidly, with now 3 Red Cross volunteers reported dead. Here's the latest numbers we have, but please bear in mind they are changing quickly. Over 850 suspected cases and 200 deaths have been reported. It's a very rare strain of Ebola from the reports. The World Health Organization now declaring Ebola an international public risk. We know it's a health emergency. I'd like to bring into this conversation to get his view very quickly. He's a busy man, of course, bioinformation and infectious diseases expert, Professor Tulio de Oliveira. Of course, you'll know last week when we were covering the national orders, he was given a national order by the president. Prof, just while I have you with me, first of all, congratulations on that. Well-deserved, of course, from everybody in the country. Just tell me about how bad this is now, because the numbers have just skyrocketed. Why? Why have we seen this jump? Hi, Prof.
Okay, thank you. Thank you for having me, and thank you for the congratulations on the order of Bundibugyo. Yeah. So there is 2 reasons why the number are increasing very rapid. The first, it is a positive, yeah, because there is a accurate diagnostics, yeah, and the contact tracing is working. So, for example, yeah, it's getting close to 1,000 diagnosed cases, as you highlight. And what we know from the last few days is that the positivity rate of the testing, yeah, is close to 50%. What it means that it's active, yeah, contact tracing, testing, and isolation. So that's the good news. We have a diagnostic that work well, and there is teams that are following the individuals. The bad news is that this outbreaks potentially is spreading for close to 2 months. Yeah, it's still quite restricted. Yeah, to the Ituri region. That's the province. Yeah, but we already see some cases. For example, in Uganda, 5 cases in Uganda.
How worried are you, Professor, and experts of the world, that this could spread beyond the DRC and Uganda? How concerned should we be, if at all?
So the main thing that we are really worried is for the local population in this region, yeah, of the Democratic Republic of Congo, Ituri. This region, it has been hit by conflict for the past decade. Yeah, the healthcare system is really in shambles. Yeah, so we really worry for this population that's already suffering, yeah, from both lack of healthcare, for conflict, to get a big outbreak of Ebola. So, and that's where the international response and the support should focus to control the outbreak there. In relationship to spread cross-border, we are less worried than that, because what we know, so for example, the first cases that went outside this region to Uganda, to Kampala, were people seeking health care, yeah, and Uganda, it is probably the country that have the best experience of controlling Ebola. And what we also know is that this virus is not a respiratory virus transmission, that someone get in a airplane and then everyone get infected in the airplane. To be honest, you have to be in really close contact of blood fluids. And what we know from the biggest outbreak of Ebola that happened around 10 years ago in West Africa, 28,000 infections, it didn't spread cross-border. We had a handful of cases of healthcare workers in the UK, in the US, but that neither they died and neither caused a large spread. So at the moment, our focus and our heart is with the population in that region that is being severely affected, but we don't have reason to believe that will spread globally.
And Prof, I understand you're over in Munich at the moment, in Germany. I believe one of the infected people has been flown to where, obviously in Germany, in Munich, I understand. Why is that the case? And also just your comment on the 3 Red Cross volunteers reported dead. I would have imagined they would have had all the preventative measures and PPE in place. That's very worrying for health workers on the ground, isn't it?
Okay, so first, yeah, so that's an American healthcare worker that has been infected in the Democratic Republic of Congo that flew to Germany. Why Germany? Germany, and I am here, it's a lot of news, yeah, on Ebola, because Germany, it's where it has the big air bases from United States of America. So this patient and his family were flew to Germany, then they were moved to Berlin to the Charité hospital. That's the most advanced hospital. He is in isolation. He's not developed severe symptoms of Ebola. He's sick, but he doesn't need ICU. What's good news? Also good news is that his family, it's in the other isolation next to him. They keep being tested and they are negative. Yeah. So just to highlight that once you have this introduction of cases in countries that has facilities, it's easy to contain. In relationship to the healthcare workers from the Red Cross, and we also know that there is a large team from the Doctors Without Borders, MSF. Yeah, they were people that were in the ground in responding to the outbreak before the outbreak was really completely known, and that's so when you don't know that is a big Ebola outbreak, yeah, then the levels of PPE is not extreme. Now they know and they are respond. That is very sad that 3 medical personnel passed, but now more PPE is being available, and also for the public and anyone in South Africa that would be very important to support these two organizations, both the Red Cross and the Doctors Without Borders, because they are the first responders. They are where they go when no one wants to go to protect not only the population, but the rest of the world of infections like Ebola.
Prof, just briefly before I let you go, I know you're a very busy man. You're not in Germany on holiday, of course. You're hard at work. I'm not sure if I'm using the word vaccine correctly or a word cure in this case for this strain of Ebola. Are we seeing a timeline potentially? I know there's no cure for it, but maybe a vaccination. Is there a timeline in mind? Where are we on that process?
So this is one of 6 strains of Ebola, and they are very different. Yeah. So to this strain, yeah, we do not have a vaccine. The only vaccine that exists that's efficient is for the Zaire strain. Yeah, and this one, the name is Bundibugyo. Yeah. So it's very unlikely that we're going to have an efficient vaccine before this outbreak stops. But what we know is that many groups around the world, yeah, are working to develop a vaccine. So the moment what is the best active to control this outbreak is the basic of outbreak response, that diagnose, which we have a very good diagnose, contact tracing, isolation, and people that get infected, yeah, to be put in with support, with good support from ICU. So that's the best response that we have at the moment before a vaccine become available.
Professor, I'm going to say thank you very, very much making time for us. A very busy professor, isn't he? He's actually over in Germany at the moment. Professor Tulio de Oliveira, bioinformation and infectious disease expert, and as I mentioned at the top of the interview, also a recipient of a national order for his work from the President himself. Prof. de Oliveira, thank you very much, sir, for your time.